Good evening, everyone. Panchajanya, the divine conch of Bhagavan Sri Krishna, which was blown during Kurukshetra, indicating the start of Dharma Yuddha that followed. There, all the efforts were done for the establishment of Dharma. Dharma was kept over personal relations and motives. Keeping the same motto in mind, our organization will work towards establishing the importance and necessity in following and imbibing Bharatiya culture, accepting our roots, and making people realize the true essence of Ayurveda not only as a treatment modality but also as a way of life. All this while walking in a path of Dharma. Hence the motto Shreyam Bharatiyam Arogyam Ayurvediyam. The founders of this organization started this because we felt the need to spread the knowledge of Bharatiya culture, Ayurveda, the true history of Bharata Shastra, and values to all the peoples in every corner of the world. Also, the founders being Ayurveda aspirants known the inside out of today's medical field, hence they aim to make people aware of this and also do their best to solve this on a go. With this aim in the mind, I would like to welcome you all to the Pragnavaridhi lecture series conducted for the first year students. Today we have Vaidya Lakshmi ma'am with us, who is presently working as an assistant professor in the Department of Shareera Rachana. Ma'am has presented three scientific papers in various national and international seminars. Ma'am has attended more than 10 workshops, seminars. Ma'am has conducted a research project, an open labeled black box clinical study to investigate efficacy of add-on personalized Ayurveda intervention in comparison to the stand-alone treatment based on ICMR guidelines in patients with COVID-19. Ma'am has received a 7th rank in RGHS in MD examination. Today, ma'am will be taking the topic anatomy of respiratory system. So, ma'am, thank you for accepting the invitation, ma'am. You can carry over the session.
Thank you for the intro. So, good evening, students. So, as she said, I am Dr. Lakshmi. I am working in Chennai as assistant professor in the Department of Rachana. So, today the topic given to me was respiratory system. So, according to the NCSM syllabus, I believe the audience of this would be the students who are going to appear for the first professional university exams, which is going to come very soon. So, with that in mind, according to our syllabus that has been provided to us, respiratory system typically carries 10 marks, out of which they have mentioned that the long answer questions would not be asked. There will be only short answer questions and MCQ. So, based on that, we can expect questions in both these sections, out of which they have specifically mentioned certain topics under must know, which a student should know, and certain topics which are desirable to know. There are some topics like that. So with this, I think I'll just give you a brief idea about the entire respiratory system today. So can you please move to the next slide? Okay, so respiratory system, as you all know, it is basically doing the entire oxygen delivery system. So in respect to the anatomy, we need to see what are the structures involved. So can you please move to the next slide? Next slide, please. The physiology part of it, I'm just skipping because it's purely the topic given to me is just anatomy. So as you can see in the picture, so the respiratory system, even in the syllabus, they have specifically mentioned the entire route that the respiration follows. Previous slide, please. Yeah, the picture. So the entire route, as you can see, as we inhale the air, it starts right from the nose, then the air passes through the entire nose and then goes down through the pharynx. Specifically, we have parts of the pharynx and then slowly enters into the thoracic region where it passes through the trachea, then gradually it enters into the lungs and then does the entire function. So this entire process is also supported by the diaphragm, which is the demarcation between the thoracic cavity and the abdominal cavity. So this is the entire route of the respiratory system. So if you see the syllabus also, the area the air is passing is what is being given in our syllabus. So we should also know it in that order. Next slide, please. Next. So all these are the physiological part of it. I'm just skipping all this. Next slide. Yeah. So starting with the nose. So as we all know, nose is to be learned separately as a sense organ. In respiratory system, they have mentioned a part of the nose, which is the nasal cavity. Okay. So nasal cavity, as we all would have learned in the nose as a sense organ. So nose is basically having two parts, that is the external nose and the nasal cavity. So the external nose, again, all of us know that there are nares, then there are nasal septum, then there are root, dorsum, tip, and the septum and also all these are covered in the external nose. Whatever we see it from the external part, whatever is visible, this is the root, this is the dorsum, this is the tip, then we have the nares, then we have the nasal septum, which is dividing the entire nasal cavity into two, and then the columella. So what we see from external part is the external nose. Then comes the nasal cavity as such. Okay, the cavity, which is the space inside the nose through which we inhale the air, that is basically divided by the nasal septum into two different sections. So each cavity, next slide please, each nasal cavity, as you can see, so the space through which the air is inhaled in is what we are going to look into in the terms of respiratory system alone. So the nasal cavity, the space inside the nose, what we are talking about, has only few parts. It is the roof, the floor, a medial wall, and a lateral wall. So as you can see, the when we take the right nasal cavity, the medial wall would be the nasal septum and the lateral wall would be the nares. Okay, so that way there is a roof, there is a floor, and as you all know, the floor is obviously the maxilla and the palate bone which is involved. The floor of the nose is obviously the maxilla on the either side, and then the palate bone, which is the separation between the nasal cavity and the oral cavity. So the floor is always that, and then comes the roof. So as you know, the nose is in a slanting position, so it goes this way, then there is a straight transverse area, and then again it is slanting down. So this slanting position, this slanting way that it goes, okay, is formed by the frontal bone, the nasal bone, and some cartilage. As you see, this is the cartilage, then we have the frontal bone and on the top, and then the nasal bone. All these together form this slanting line, which is what we see external. Okay, then there comes a straight horizontal plane, which is actually the cribriform plate of the ethmoid, and then comes again a slanting portion, which is actually a part of the sphenoid bone. So this is how the nose is placed, that is in a slanting way, whatever we see on the nose, then comes a horizontal plate, and then comes again a slanting position, which is the sphenoid bone, which is involved. So that is how the nasal cavity is entirely explained. So through this, we inhale the entire air. So at the back end of the nasal cavity, we have, it is going to join with the pharynx, or more specifically, next slide please. More specifically, it is going to join with the nasopharynx. So this is what I was just explaining, the internal nair, external nair. This all comes under the nose as a proper sense organ. Here we are only concerned about the nasal cavity, which is the space between the nasal septum. Okay, next slide. Yes. So as we inhale the air, we have finished the nasal cavity. Then the air directly enters into the pharynx. Pharynx is obviously divided into three parts, that is the nasopharynx, oropharynx, and the laryngopharynx. So out of which the nasopharynx is having the adenoids, okay, which is the most important relation in respect to the nasopharynx. So the air that we inhale is going to reach the nasopharynx at the fag end of the nose, and then slowly the air will come down. Next slide, please. Yes. So as I was telling, after it reaches the nasopharynx, it is going to the nasopharynx is having the pharyngeal tonsil or the adenoid tonsil, which is actually a part of the Waldeyr's lymphatic ring. Okay, there are four sets of uh, tonsils which are present around the back end of the oral cavity, out of which one is the adenoids that is present in nasopharynx. So as soon as the air reaches the nasopharynx, then it travels down, as you can see in the picture. It reaches the oropharynx, which is a common pathway for both respiration as well as the food intake, for digestive tract as well as for respiratory tract. This is a common pathway. Then slowly it moves down into the larynx. Laryngopharynx is the most posterior most part, which is going to continue as the esophagus. From oropharynx, it is going to enter into the larynx directly. So this process of transformation, that is directing the food into the esophagus or the laryngopharynx more specifically, and directing the air into the larynx, is actually governed by the structure called epiglottis, which is actually a part of the larynx. It is a cartilage which is a part of the larynx itself. Okay, so it is the epiglottis which is going to decide, or which is going to push the food rightly into the laryngopharynx and push the air rightly into the larynx so that it reaches the respiratory tract. This That is why epiglottis is always important anatomically. Next slide. So as we have finished the pharynx, then we slowly enter into larynx. So larynx basically is the voice box, which is actually preventing the swallowed materials from entering the lower respiratory tract. So, and it conducts air into the lower respiratory tract. So all that we know. Okay. So larynx basically anatomically or structurally, larynx has 9 cartilages. So all these could be easily asked as MCQ. So 9 cartilages of larynx, which can be divided into 3 paired and 3 unpaired cartilages, which means there are 6 paired cartilages, 6 numbers of paired cartilage and 3 unpaired cartilages. The total makes it to 9. So the 3 unpaired cartilages are epiglottis, thyroid cartilage and the cricoid cartilage, out of which few you can see in this picture. So 3 unpaired cartilages are epiglottis, thyroid cartilage and the cricoid cartilage, in which epiglottis is what I was mentioning it as a doorway between the larynx and the laryngopharynx, which is governing the entire process of while swallowing. Then comes the thyroid cartilage and the cricoid cartilage. Cricoid cartilage is the lowest part of the entire larynx. Okay. Then comes 3 paired cartilages, which are arytenoid cartilage, corniculate. Am I audible?
Yes, ma'am, you're audible, ma'am.
Pratiksha, am I audible?
Yes, ma'am, you're audible.
Hello, Pratiksha. Am I audible?
Yes, ma'am, you're audible, ma'am.
Okay. I just got a call and the entire thing got stuck. I'm sorry. So let's continue with where we left off. Larynx, the cartilage is what we were discussing. So out of which the paired cartilages are arytenoid, corniculate, and the cuneiform. So the names of these cartilages are very important, because as you know, it can be easily asked in MCQ, and we do expect a lot of MCQ from the respiratory system as such. So all these names are important both for your theory exam as well as for the Viva. These are commonly asked Viva questions as well. So those are the laryngeal cartilages. So with that, the air has finished the half of the way, and then it properly enters into the thoracic cavity. And then the next structure which is following downway is the trachea. Next slide, please. Yes, trachea, as commonly we know it as the windpipe. Okay, so it's a white tube which is lying more or less in the midline of the neck, and then the actual position of the trachea is in the superior mediastinum. So mediastinum, as we all know, it is basically divided into superior and inferior mediastinum. That is, you can imagine it as rooms. Mediastinum is actually a space which is available for this particular organ, heart. Okay, so this mediastinum is, you can imagine it as two rooms, a superior room and a inferior room. You imagine it as a ground floor and a first floor. So the first floor superior mediastinum is over. The ground floor, that is the inferior mediastinum, is further divided into three, which is the anterior, middle and posterior mediastinum. So we have three rooms in the ground floor, which is the anterior mediastinum, middle and the inferior mediastinum. Out of which the trachea that we are talking about lies in the superior mediastinum. So each mediastinum has different contents. Accordingly, the explanation of those contents will be easier to understand. That is why they have made such a division. So coming back to trachea, it lies in the superior mediastinum. As I told you, it is continuous with the lower end of the cricoid cartilage. So the entire larynx ends with the cricoid cartilage, and then downwards starts the trachea. So trachea is basically a tube with 16 to 20 number of fibroelastic cartilaginous skeleton. So it is like almost 3/4 of rings which are present uh, in numbers, that is in 16 to 20 in numbers. So these rings are actually not complete, they are halfway incomplete. The entire ring is actually incomplete posteriorly, which is actually filled in by the muscle called trachealis. Okay, so the entire uh, trachea ring lies like this. The 3/4 of the ring is present. Rest of the ring is actually filled in by the muscle called trachealis. So that is how the trachea is made. So this number of the tracheal rings and then the covering it by the trachealis, all this is important. Easily asked MCQ questions. And then obviously the length of the trachea, the dimensions, the width of the trachea, the lumen is actually smaller in living than in the cadaver. So all such minute details are easily asked, and it is also very important for a student to know all this. Okay, so this trachea at the level of the sternal angle gradually bifurcates into two small tubes, which is the right and left primary bronchi. Okay, this, as the bifurcation happens, from here on it is going to divide into small and smaller parts, which is together called as the bronchopulmonary segment. So the initial division of the trachea, it moves down and divides it into two, which is the right and left primary bronchi, out of which the right side of the division of the trachea is the wider one and the left one is the longer one. Right side is wider and shorter. The length is small, whereas the left side is longer and less wider. Okay, which makes the right side of the lung, the right principal bronchus, more prone for the infection. So always when we see in all the pediatric cases, it is very commonly seen that the right lung is often affected. It is because of this anatomical reason that the right principal bronchus is wide and less in length. That is, it is shorter, which is why this process of infection is very easily catching up the right principal bronchus and thereby affecting the right lung very commonly. So that is how the trachea is involved. And then comes the after trachea. Next slide, please. So as you can see, after trachea, the bronchus slowly, the bronchus is dividing it into parts. So from here, it is called the bronchial tree. Okay, we'll come to the bronchial tree later as the slide shows lungs. So next major organ or the organ of respiration, whatever we consider it as a main organ in the entire respiratory system, is lungs. So lungs, as you know, it is basically two in number. They are conical in shape, and the base which is resting on the muscular diaphragm. There are two lungs which are of different sizes also, and each lung is going to have an apex, a base, then three borders and two surfaces. So this is the base of explaining the anatomy of lung. So every time you start explaining an organ, this is how you start explaining, that is, the external features of the organ we'll start, and then gradually explaining each one of it will actually finish the entire anatomy of the organ. So taking up the lungs, it with the conical shape, they have explained the apex, then there is a base, then there are three borders, which is the anterior, posterior and an inferior. So between the, that is between the medial surface, there are two borders, anterior border and a posterior border. Then there is an inferior border as well. So there are three borders to the lungs, and then two surfaces, which is the costal surface, which is being covered by the ribs. All coastal, the word coastal is always related to ribs. So the area covered by the ribs is called the costal surface. And then there is the medial surface that we were talking about, which is facing the heart. Okay, both the sides of medial surface of the lung will face each other with the heart in between. So the front end of the medial surface is the anterior border, the back end of the medial surface is the posterior border. So with this basic idea, you can start explaining each part of the lung. So each one, again, apex is blunt, whereas base is concave. So this base is going to rest on the diaphragm. Such minute details you can explain in each part of it. And then comes the borders. So in this borders, the most important thing is that the border is slightly different in both right lung and left lung. So as we all know, left lung is having this special cardiac notch or the lingula of the left lung. Okay, that
anterior border of the left lung is actually notched, and it is forming a slight curve, like notch is a curve. It is forming a slight curve on the left lung, which is called the cardiac notch. It is actually providing a space for the heart to rest on it. Okay, so that is the major difference externally when we see from the lungs, right and left lung. And then the lobes. So that is how we explain the basic external features of lung, all the surfaces, borders, all that is covered. Then comes the lobes of the lung, fissures and lobes of the lung. So both the lungs are basically divided into lobes by certain fissures. Again, there are some differences. That is, the right lung will have two fissures, thereby there are three lobes. There is a horizontal lobe, which is straight, and then there is a oblique fissure. That is a horizontal fissure and oblique fissure, making the right lung divided into three lobes, whereas the left lung has only one fissure, thereby the left lung will have only two lobes. So that is the basic difference between two lungs. May I have the next slide, please? Yes, as I was mentioning, the left lung is having uh, two lobes divided by one fissure, which is the oblique fissure, whereas the right lung is having three lobes, which is divided by the two fissures. So all these names of the fissure and the number of lobes is all important. Next slide. Okay, so I think the slide is getting over there. So after the lobes of the lung, the major part of the important part of the lung is the root of the lung. That is, the on the medial surface of both the lungs, we have certain structure which is entering in, which we discussed earlier. That is, the principal bronchi is going to enter through the root of the lung. So in other than that, there are other structures also. The main content is that. So the contents entering through the root of the lung is very important, because there is slight variation between the right lung and the left lung. So this difference is also important, especially because we are expecting short answer questions from the respiratory system. So each lung alone could be asked as a 5-mark question. So out of which you need to explain all this root of the lung in detail. So what is the difference between the right and left lung? All that is important. So there is a particular arrangement of all these structures throughout the lungs, and also the differences between the right and left lung is also a very, very commonly asked question. So that is also very important. So with that, I think the entire lung anatomy is getting over. Lung is a very easy organ to learn. Just this, remember this conical shape, an apex, a base, certain borders and two surfaces. We'll explain all that. Then there are lobes and fissures, how lung is divided internally, all that is covered. Then the root of the lung. So what are the structures entering through the root of the lung, that is hilum of the lung, inside whatever is going, and the difference between the right and left lung. This much is covered inside the lung anatomy, followed by its usual blood supply, nerve supply, and all that will be covered, followed by that. So after this, we have finished the lung anatomy. So out of the entire respiratory system, lung anatomy is something that every student should know, both anatomically as well as clinically, because nowadays we are seeing so much of cases, especially post COVID. The importance of the lungs has been very much understood by the public. So clinically also, it is always helpful if a doctor knows well about the respiratory system, not just physiologically but anatomically also. Just like I mentioned, the right lung or the right bronchus being commonly affected with all these infections in pediatric cases, all these actually come out of a proper anatomical knowledge. So such things can never be missed by doctors. So all these informations are very important. In this way, anatomy is going to help you as a doctor in future. That is why always knowing the normalcy of body, normalcy in terms of anatomy and physiology, will help a doctor to learn better about the diseases in the next coming years. Once you know what is normal in the body, or normally what is the structure, normally what that structure is doing, that is the function of that structure. Once you know all this, then when we learn about diseases, which is the deviation from the normalcy, then that disease, the understanding of the disease would always be better. Unless you have a proper foundation of anatomy and physiology, the learning of diseases or the pathophysiology would always be incomplete. So it is always good to know all these anatomical related aspects. So moving on, before we move into the pleura, I think there is bronchial tree. So when I was mentioning the syllabus that was given to us, so there are bronchopulmonary segments. So as I was mentioning, the trachea is actually dividing it into right and left principal bronchus. This principal bronchus is going to enter into the lungs. Inside the lung, it is going to divide into secondary lobar bronchi. Secondary lobar bronchi is equal to the number of lobes in each lung. So in the right lung, there would be 3 secondary lobar bronchi, and in the left lung, there would be 2 secondary lobar bronchi. So then further it divides into tertiary segmental bronchi, and then finally terminal bronchioles, and finally the respiratory bronchioles, or smallest part of the bronchiole. So we are seeing a gross structure starting from the trachea, moving inside the lung and becoming smaller and smaller and smaller section, and finally reaching it into the alveolar ducts and all. Okay, so this is how physiologically the air is going to finish the entire process of the oxygenation and sending out the carbon dioxide. So this way, the structures involved in the entire breathing process is important. So this bronchopulmonary segment, that is this segments inside the lungs, is named as bronchopulmonary segments. So there are 10 bronchopulmonary segments, which actually is relevant nowadays. In the syllabus, they have given it as decide to know. So if you know the names of the bronchopulmonary segments, it is very well and good. At least you should know the number of bronchopulmonary segments, or at least how the bronchus is dividing, finally dividing into smaller structures. All this is going to repeat in physiology. So anyway, knowing this would always be good. So that is how the bronchial tree is formed. Smaller sections of the bronchial tree is formed this way. So starting from the nasal cavity, we have reached into the entire lung. The minutest portion of the lungs we have covered. Next comes the covering of the lung, which is the pleura, which as you can see in the PPT, pleura, pericardium, all these coverings of these important organs are also commonly asked, and also they are clinically important. So pleura, as you know, very easy. Those are 2 layers. There is a visceral pleura and a parietal pleura. Parietal pleura, which is going to stay away from the organ, and the visceral pleura, which is going to stick onto the organ. So the gap between them, that is a small cavity between these two, is going to be called as the pleural cavity, out of which parietal pleura is only having some divisions, which is the costal That is the medial surface of the entire lungs is going to be the costal pleura. Then there is diaphragmatic pleura, which is the base of the lung. Mediastinal pleura, which is going to cover the medial surface of the lung. And then cervical pleura, which is on the top. That is the apex of the uh, lungs. Okay, so it is one single covering, but the same pleura at different parts is given different names for us to understand. That is all. So the costal pleura is at the the cervical pleura is at the apex of the lung. The costal pleura is going to cover the entire costal surface of the lung. Diaphragmatic pleura is related to the base of the lung, and the mediastinal pleura is going to cover the medial surface of the lung. So that is how the parietal pleura is divided. So all this explained in few words can easily make up to a 5 mark, followed by a proper neat diagram, which is always expected in any anatomy answer. Then comes the visceral pleura, which is going to stick on to the organ and you can never strip it off. And in pleura, then the most important thing is that the pulmonary ligament and the recesses of the pleura. So recesses of pleura, recess, the word itself is space. Okay, so even though the lungs has been given a little bit of space for it to expand and contract for the process of respiration, sometimes whenever we have labored breathing or exerted breathing, or when we are running, when we are walking, in all such process we always tend to take in deep breaths. We need more of oxygen to do the work, to finish the work quickly. So in that labored breathing and all, there is the lungs need an extra space to actually expand into. Okay, so those areas are called recesses of pleura, into which the lung expanded when it has got an extra work to do. In normal breathing, the lung is not going to use up those spaces, but when there is work, specifically when we are running, or there is labored breathing, or we have some issue, then such spaces will be used. So the recesses of pleura include the costo-mediastinal recess and then the costo-diaphragmatic recess. So in all such recess, during inspiration, the lungs is going to expand into these spaces. Similarly, the pulmonary ligament is also a similar structure present in the root of the lung. Okay, so this pulmonary ligament is also going to provide an extra space, which into which the pulmonary artery or the vein is going to descend when there is an extra load over it. Again, the same thing, when they are actually providing a safe space for these structures, because these structures are very, very, very important. So for them to perform under pressure, they are expecting an extra space, which is the pulmonary ligament and the recesses of the pleura. So with this, pleural anatomy is also over. It is basically a covering. It has two types, the parietal and the visceral pleura. Same thing is going to repeat in the peritoneum also. So all these can be easily understood. Then only thing extra in pleura is the recess of the pleura and the pulmonary ligament, followed by the applied anatomy of pleura, which is very important nowadays, because pleurisy or the inflammation of pleura, pleuritis, all this is very much common nowadays. So knowing the anatomy and then getting to know the disease is always good. So we have enough uh, clinical anatomy related to the pleura itself. Okay, there is pleurisy when the pleural cavity is filled with blood, then it is hemothorax. When it is filled with air in the sense when it is beyond a limit, it is called the pneumothorax. Then there is hydropneumothorax, where there is fluid and the air. When it is pus, then it is called empyema. So different uh, terminologies according to the content present inside the pleural cavity can be easily remembered and mentioned in the theory part of it. Also, this is commonly asked as a viva question also. Same thing, the pleural fluid being aspirated out externally through a needle is called the paracentesis thoracis. Again, this is a term which is going to repeat in the digestive system as well, because when there is extra peritoneal fluid, the same process is done. It is paracentesis abdominis. Here we are doing it in the thoracic cavity, so it is called paracentesis thoracis. So all this applied anatomy in the pleura is also equally important as the structure. Okay, so with that, pleura and the pleural cavity, all that, the pleural effusion, as you can see, all this is covered in the pleura. Next slide, please. So as you can see, we have covered almost the entire root of the respiratory air, okay, whatever we inhale in, then it is going to reach this maximum point at the bronchioles, and the alveola is the maximum point it reaches. The covering of the lung is what we have covered. The last left, next slide please, last left out uh, point in the respiratory system is the diaphragm. Okay, so diaphragm, as you can see in this picture, it is a dome shaped muscle. It is a skeletal muscle. Okay, so we know it is going to demarcate between the thoracic cavity and the abdominal cavity. So diaphragm, though it looks very simple, but it is doing a very important work throughout the life of a human being, because every time we inhale in, the diaphragm is going to push down all the organs of the abdominal cavity. Slightly it is going to push down, making some amount of space available for the lungs to inhale in. And as soon as the lungs is done doing all that, and when it is going to exhale, then the diaphragm is slowly going back into the position. As I explain it, there is only a slight variation in the entire movement of the diaphragm, but this slightest movement variation is very important for respiration as well as in the digestive system, because every time it is going to push the organs down, it is going to increase the intra-abdominal pressure. Okay, so for a person for whom the intra-abdominal pressure is already more, then the normal respiration is going to increase the load over it, and thereby all such related fine symptoms, minute symptoms can be explained. So very commonly seen example is that a person with asthma, bronchial asthma, can actually not lie down flat. It is very difficult for them to lie down flat because it is pure anatomy and physics. Okay, that is, when we lie down flat, the diaphragm is going to push the lungs a bit more onto the top. Okay, so and it is going to provide more space for the abdominal organs. So a person who is having bronchial asthma is already longing for more amount of oxygen. He is not getting enough amount of oxygen because the bronchioles are not properly dilating and getting in enough amount of oxygen. In such a case, when lying down, the diaphragm is going to push the organ and thereby causing a distress to the patient. So, if a patient of bronchial asthma has to lie down, he has to lie down in a slanting position, as in the head and the upper end of the body should be slanting, and the rest of the legs can be actually lying flat. Okay, so this is the typical position described for a asthmatic patient, because in that position, diaphragm will actually relax and provide enough space for the lungs to expand and relax. So in this way, diaphragm is very important in both respiratory system as well as in the digestive system. So that is the importance of diaphragm. I was just mentioning about it because all such minute things can help a doctor in certain situations, because asthmatic patients always could come in as a emergency patient. So the first resort that a doctor should do is that make them sit in this slanting position, and rather than making them lie down. Okay, so all this uh, knowledge comes out of this proper anatomy. Okay, that is why all this is important. So diaphragm, as I was mentioning, it is a muscle of inspiration itself, and it's a skeletal muscle. So being a muscle, it should have an origin and an insertion as well. So the origin obviously is from the sternum, then a little bit origin is from the sternum, then there is from the ribs, and then followed by the vertebrae also. Specifically, it is from the lumbar vertebra, which is L1 to L3. So from three different areas, the diaphragm is going to originate. One from the front, which is the sternum, one from the sides, which is the ribs, and one from the back, which is the vertebrae, specifically the lumbar vertebra. So from three different points, the diaphragm is going to originate, and then it gets inserted. A muscle should have an origin and insertion. So this is the origin, followed by an insertion, which is the central tendon, which is in the center of the diaphragm. So this is how the diaphragm has to be explained: an origin and an insertion. So each origin, there is a detailed explanation, which I don't think I have enough time to explain it here. So the origin and insertion of that muscle is covered. Next important sub point in the diaphragm is the openings of the diaphragm. So diaphragm, being the demarcation between the thoracic and the abdominal cavity, has to let in certain structures from the thoracic cavity to the abdominal cavity, like the esophagus, like the aorta, like the inferior vena cava. So these three important structures, along with some other minute structures, is also going to pass down from the thoracic cavity to the abdominal cavity. So for that, there are three proper openings in the diaphragm at three different levels. So these levels and the openings and the structures passing through them are very, very important for a student to know during your viva, during your MCQ also. And diaphragm assets could be asked separately as a 5 mark also. Then also you need to write these openings because that is the most important part of the entire diaphragm. Okay. So in this opening, as I was mentioning, there is aortic opening meant for the aorta, which is the thoracic aorta, which is going to pass down and continue as the abdominal aorta. Along with that, passes the thoracic duct, which is a part of the lymphatic system. Then there is esophageal opening meant for the esophagus and the vagus nerve. And then there is caval opening, which is for the inferior vena cava. So again, each opening is at different levels. So these levels are also important. So there's a mnemonic which is there for this diaphragm opening. That is I8, I8, 10x, 10x at 12, at 12 o'clock. Okay, so I ate 10x at 12 o'clock. So this is the mnemonic for the diaphragmatic openings. So that is I. I is the inferior vena cava, which is at the level of I8. 8 is what we eat, which can be taken as 8. So it is at the level of T8. Okay, so the first thing is I inferior vena cava, or the caval opening is at the level of T8, followed by 10 eggs. Okay, so eggs, E, they have taken it as esophagus. So esophageal opening is at the level of 10, T10, followed by aortic opening at 12. A is for aortic and 12. So aortic opening is at the level of 12. So I ate 10x at 12. So there is I ate 8, 10 and 12. I is for inferior vena cava, 10 and the E for esophageal opening and aortic opening for the at 12 o'clock. So this is an easy mnemonic that we can remember because these levels T8, T10 and T12 are very important. At each level, each opening is present for the diaphragm. So that is the basic anatomy of the diaphragm, followed by the blood supply, nerve supply. Phrenic nerve, as we all know, phrenic nerve could be easily irritated, could cause hiccups, which is very, very common and explained in Ayurveda as hikka. Hikka, again, there are different types explained in our Shastra, almost 5 types, out of which one is actually fatal, which is Raja Hikka, which is actually fatal. So, Hikka is not just the diaphragm involved, but the phrenic nerve is obviously involved, or it is irritated when we get hiccups. Okay, so it is basically Vayu or Vata. So Hikka or Hidma is actually a pravrti of Vata explained in Ashtanga Hridaya. So that is diaphragm, then followed by applied anatomy of diaphragm, in which the most important disease is the hernia, diaphragmatic hernia. So when this openings of the diaphragm becomes loose, specifically the esophageal opening, when it becomes slightly loose or it becomes flabby, it is structurally correct, but functionally it becomes slightly weak. So that is always an option given by the Ayurveda system. So any structure could be correct structurally, but it can be functionally weak. So in this case, diaphragm, they have mentioned this diaphragmatic hernia where sliding hernia, where after esophagus continues it as the cardiac notch and then the stomach. So this is how normally it is present. But when the opening becomes slightly flabby, there is a good chance that the organ, that is the top end of the stomach, is going to slightly push in through the diaphragm and slowly move into the thoracic cavity. It could go up and then come down. This is called sliding. So this is called the sliding hernia or diaphragmatic hernia. So this is often seen nowadays because along with this process of pushing into the thoracic cavity, the contents inside the stomach could also easily get pushed into the esophagus, thereby causing acidity or this gastroesophageal reflux disease, which is known as GERD. Okay, so all this can be attached to symptoms of this disease. So often when we take an endoscopy for a GERD related patient, this is the often finding written in the endoscopy report. Because of the structure pushing in, they say the lower end of esophagus is inflamed because of all the acidic contents from the stomach. So this applied anatomy of diaphragm is important. Other than that, hiccups is also an applied anatomy.
Hiccups is also an applied anatomy. And then the unilateral and bilateral paralysis of the diaphragm is also an applied anatomy. So this way, diaphragm is also covered. As a diaphragm has to be explained. Obviously, it is a 5 mark, separate 5 mark question could be easily asked, but it is very easy. Being a muscle, you need to write an origin, you need to write an insertion, followed by these openings, clearly mentioning all the openings at what levels and what are the structures which is going to join with the main structures, and then followed by the nerve supply, blood supply, the regular things, and the applied anatomy. So it's very easy. So next slide, please. Yeah, from here on it is the previous slide. I'm sorry. So from here on it is purely the physiology of the lungs. So with this, I think the entire. Can I go to the previous slide? Yeah. So with this, the entire respiratory system or the tract is covered. That is the right from the nose, whatever we are inhaling till the last part with the diaphragm involved. We have covered all the entire route that the respiration process takes through, right? Starting from the nasal cavity, ending it with the alveoli, followed by the pleura and the diaphragm. So these are the parts of the respiratory system as a system when we take, okay, out of which, as I told you, nasal cavity is going to be a part of the nose as a sense organ itself. So learning it in the nose can also help you in the respiratory system also. So with this, I think the entire respiratory system is covered. So as I was mentioning, in this, the nasal cavity, all such minute details could be easily asked. I think I'll mention what are the generally asked MCQ and the 5 mark question. In terms of MCQ, you can expect the nasal cavity related things and then followed by the pharynx, which is going to come in both digestive system and the respiratory system. So the clarity on which the way the air and the food follows has to be there for every student. So air is going to come down and take in the front route, and food is going to go down, and this entire process is being governed by the epiglottis. So the clarity on that is very important. So pharynx also, along with the Walde's lymphatic ring, which I was mentioning it in the nasopharynx, is also commonly asked MCQ. The number of tonsils, what are the tonsils present in each area, all that can be easily asked as MCQ. Other than that, pharynx itself is a separate 5 mark question, could be asked in the aspect of digestive system. Here we have only nasopharynx and oropharynx. Then comes larynx. So as I was mentioning, the laryngeal cartilages, the names of the laryngeal cartilages are very, very important, and the numbers and where it begins, where it ends. There are other fine, minute details in the larynx which could be confusing, but you should have a basic idea of what larynx is going to do. It is basically voice box. It is going to produce voice because of all the nerves which is present, but there are certain cartilages present for it to produce that function. So that names of the cartilages, the numbers are very important. Then we come into the trachea. Again, the how the trachea is basically placed. We have certain 16 to 20 tracheal rings, followed by this trachealis muscle, which is going to cover up the circle. So that a basic idea of what trachea is going to do. The length of the trachea, it is around 15 to 20 centimeter. Such dimension related questions can also be asked in MCQ. Then comes the division of trachea, that is Shareera. The sternal angle trachea is going to divide into two. So the basic division of how trachea is going to divide into smallest alveoli is also easily asked in the MCQ or even in Viva as well. So a medical student is supposed to know, basically is supposed to know these. Then lung, obviously we all know, and pleura and the diaphragm. So out of which 5-mark question could be easily your diaphragm, lungs, one separate lung, right lung alone could be asked, or lungs. Sometimes they could not look into the syllabus. The lung itself could be asked as a 10-mark question, which can be easily uh, elongated and written for a 10-mark because we have enough content. Lung could be asked as a 5-mark separately or as a 10-mark combined together. Diaphragm is also a possible 5-mark question. Other than that, we don't have much of a 5-mark question in the respiratory system. And they say there is no long answer question from the respiratory system. Believing that, we can read the respiratory system in this pattern, and applied anatomy of all these organs are equally important, especially the lungs, pleura, and the diaphragm. All other parts, even if you miss, the applied anatomy of these three can be even asked in the practical exams for written portion. So all that is important. So there are some portions like the root of the lung or parts of the bronchial tree. All this must is a must to know for a student, whereas some relations of larynx, what is present in and around larynx, all that is desirable to know. So if you will go through the syllabus properly, you will get an idea. But I hope with this you get an overall idea of the entire respiratory system, how it is actually easy to learn, not without much difficulty. You can understand. Uh, Once you understand, then the process of putting in the information becomes very easier. So I think I have covered what is expected of me. So with this, I conclude my topic. I hope you find this video useful in terms of the exam. So there are very fine, minute details which are available in the respiratory system if we go down, because modern anatomy is being researched every day and the new information is being added then and there. So it is a never ending ocean for us. But somehow we need to stop at a point, no? So being a first profession student, I think this knowledge at this level is enough for being a good doctor. So I'm stopping with the same thing. In the Ayurvedic version also, we talk about the nasa, which is obviously a sense organ. You can write all the pancha panchendriya when asked. And then comes lungs, which is called pupusa. So the pupusa's origin is important. They could ask the pupusa origin in the MCQ itself. Then comes only, I think only these two are there. Then these are the main Ayurvedic version of it. And then obviously the respiratory part, which in physiology, like uh, lotus, all such descriptions could come in the physiological part. In anatomy, there is direct mention of pupusa and the nasa. That is all they have mentioned. So that also you can expect in the questions. Questions can be slightly twisted. They could ask it in terms of pupusa. So in that way also, you, if asked in an Ayurvedic terms, better start the answer with an Ayurvedic term. How whatever you know about that term, you can write for few lines, then followed by a statement saying that this organ could be correlated with such and such organ. Then you start with the modern anatomical version of it. So even though I always tell it to my students, even though you read well, even though you have the entire information required for the question, there is a way to present the answer. So that is also very important. So in a clear, legible way, students should present the answer. That will also obviously fetch you marks rather than just haphazardly answering the entire thing. So always presenting the paper in a nice way, highlighting the important parts rather than just writing it in a paragraph mode, highlighting it, putting it into points. All this is going to make sure that the examiner is going to know that okay, the student has gone through the topic, he has read well. The immediate impression would be created in the examiner's mind. So even after learning, there is a way to present every answer. So I hope you use all the techniques and the presence of mind required for a student in the exam hall to actually attend to the answer in a proper way. So I wish all of you all the best for the upcoming first professional exams. So if at all you have any doubt, you can ask me. And I think I have finished my topic. We still have 5 more minutes more.
Thank you so much, ma'am. It was definitely an interesting topic, which this vast topic you have finished in 1 hour with all the important things which you have mentioned for MCQ as well. You have also told which are the topics which has to be written in the paper to gain the marks. Even in your, despite of your busy schedule, you took some time for our session. Thank you so much for accepting our invitation, ma'am. There was a small glitch of technical issue while starting. Sorry for that, ma'am. Thank you for your patience. This was a very informative session for all the students. If any doubts regarding this topic, we'll be forwarding the questions to you, ma'am. Your answer as well will be forwarded to them, ma'am. Thank you so much, ma'am.
Yeah. Thank you, everyone. Thank you for the opportunity, actually. Thank you once again.